Okay, good afternoon. So, a lot of wonderful information that you've been given today so far. In the last few minutes, I want to talk about what it means to participate in a research study and some of the studies that are going on. By a show of hands, how many of you have been asked to participate in a research study of any kind? Okay, fair amount. Okay. So, I think broadly, we can think about research studies in two different categories, two types. So one type of study is a study that's gathering information. So this can be information about you, about where you live. It might be information about what's in your blood. And these kinds of studies are trying to learn something about what happens in the disease, either why it started, how it evolves. Another type of study is a study where there's some intervention. There's some change in your treatment that's happening. And an example of this is a clinical trial. So the studies, for example, that Dr. Maserati talked about, where you might participate in a study where you get one therapy or you get a different therapy, and the question is to ask, well, which one's better? So let's focus mostly on this set of studies about gathering information. So one that you heard about is a study that's asking, was there some association between where you live and developing lupus or how that lupus evolves? So Dorchester, Mattapan, Roxbury. A different type of study may be asking, well, are there markers in the blood that can help us make a diagnosis of lupus better, more efficiently, so that it doesn't take 6 years to make a diagnosis? Or a marker in the blood that may help us predict how the disease is going to evolve. A third type of a study within this category might be asking questions that help us better understand what the immune system is doing in lupus. Exactly how is it causing problems? So if you were going to design a study, what would you want to ask? Or what would you want to learn about lupus?
I'd be interested in having the participants in the study to be proportionate to the population at large. I'm curious about, there's so many African Americans that have suffer from lupus, and I'm not clear that African American women are the majority of the patients, the people who are studied in
Great. So critically important criteria is that the population that you're doing your study on has to be relevant for the people that actually have the condition. Okay. Other thoughts?
One of my interests was that lupus is so new to the community that why more people don't know about it?
Okay.
How can we bring it out more to people that don't know what it is?
Okay. So how do we better explain the condition to others in the community? Other thoughts?
Another thing is a lot of your studies are like Roxbury or whatever. What happened to good old Boston, you know? I'm just saying most of them are like Roxbury or Mattapan or whatever. It's like the Back Bay and Fenway area, I don't really hear them used as a study.
Gotcha. So sort of a related idea that we want to make sure that what we're studying is relevant to the greater population.
Next.
Yes?
How you measure success? What are your milestones, landmarks?
Okay. So
Statistics-wise, how are you going to say this improved it? What are you going to measure?
okay. So questions about how we're determining how we're doing with the study. And those types of studies might be about how best to treat the condition and making sure that we're measuring it properly. Okay.
Again, how did it come up that it was so much studied in Boston? Because I'm not from Boston, but how much Roxbury, I noticed all the Boston areas. And I know other people from other cities and towns that have that are lupus survivors. And they're not of Boston. Why is it particularly?
I think it's a fair question. Let me frame it a little differently. So if a patient comes to the hospital and they have a cough and a fever and they have a chest x-ray that shows an infiltrate in the lungs, we would diagnose that patient with pneumonia. And we would give that patient antibiotics. We treat the pneumonia, and by and large it'll get better, right? So we know a fair amount about what causes it. We know that it's usually a bacteria. We give a set of antibiotics, so we have pretty well worked out, and we can cure pneumonia. We're good at that. On the other hand, if you take a patient who comes with rashes, joint pain, maybe low cell counts, maybe inflammation in the kidneys, in the setting of the right evaluation, the right blood test, that patient may end up with a diagnosis of lupus. And here's a condition where we don't have a great understanding about why it happens. We don't have a great understanding about the specific abnormalities in the immune system that are causing it. And while we're doing much better with treatment than we used to do, we want to do better. And of course, we can't fix it. We can't make it go away. So many of the studies that are going on are trying to understand what's gone wrong with the immune system and how do we sort of push it back. So let me give you a different example. So Dr. Maserati mentioned rheumatoid arthritis and how well we've done in the past 10 to 15 years with rheumatoid arthritis. So let me tell you a story about this. So in 1989, there were two investigators who decided to study joint fluid or joint tissue from patients with rheumatoid arthritis. And they took cells from the fluid, they took cells from the tissue, they put them in culture, and they asked, well, what are the most important inflammatory signals? And they identified one protein called TNF that was driving a lot of the inflammation. So if they blocked TNF, they could really do a good job of suppressing the inflammation. Then 3 years later, the same group did studies in mice to test whether in mouse models of inflammation in the joints, what happens if you block TNF. And they demonstrated that the mice where they blocked TNF did much better, way better. 1 year later, there was the first clinical trial to demonstrate that if you give an antibody that blocks TNF, you could decrease the symptoms of rheumatoid arthritis in patients with RA. And so I think in relatively quick succession, a dramatic improvement in the treatment of rheumatoid arthritis. And now anti-TNF therapies are a huge portion of the treatment for RA. And so what we're aiming to do now is to sort of try, can't say that we're going to do it, but we're going to try to make these kinds of observations in lupus. Identify the key inflammatory pathways that are important, and then test those one by one, see if we can find new therapies that importantly affect the inflammation that's in lupus. So one of the studies that we're involved with is a large NIH-sponsored effort across the country to involve groups that are interested in lupus to study both blood samples and tissue samples from patients with lupus and ask about what are the most important inflammatory pathways? What are the key players that are driving the inappropriate immune response? So this is a study called the Advancing Medicine Partnerships. It's a $42 million study across many centers in the US. And the goal is to identify and validate the most promising biological targets for therapies. One of the ways that we do this, it's a few pieces to this, but one way we do this is to study blood. So in many research studies that you'll hear about, one of the requests is for a blood sample. And the reason why is that we can do a couple things with blood, but one thing that we can do is we can isolate out of blood immune cells. So these are the T cells, B cells that you heard about that are critical players in lupus. So here's if we receive a blood sample, we can separate it out into the fluid part, which is the serum. The red blood cells end up at the bottom, and there's this portion in the middle that are the immune cells, the white blood cells. So we can take these cells now and then study them with a panel of markers to try and identify, well, which ones are T cells, of the T cells, what kind of T cell are they, what do they make, and then we're asking in patients with lupus versus controls versus patients with rheumatoid arthritis versus patients with other conditions, can we find cells that are specifically unusual or behaving inappropriately in patients with lupus? So can you identify the cells that are the perpetrators? And by making these cellular maps, trying to characterize what different types of cells are there, and which ones are present in patients with lupus that look like they're bad actors. The goal is to identify new targets, new ways to try and intervene to quiet the immune system more specifically. So many studies, especially in autoimmune disease, are focused on blood. And the reason is that blood is critically important for us in a couple of different ways. So one is that we can measure proteins or other substances in the blood that help make predictions about what causes a disease or help give characteristics of one disease versus another. From the blood, we can obtain DNA to ask about genetics. And from the blood, we can identify immune cells, pull out the immune cells to ask specific questions about what the immune system is doing. So this is an important issue. So when you're asked for a blood sample as part of a study, there are rules about this. So the maximum amount of blood that can be drawn in a research study is 50 milliliters, which is about 3.5 tablespoons. So for people who think in ounces, that's less than 2 ounces. To put that in context, so if you were to donate blood for the Red Cross, for example, to give blood so that it could be transfused into somebody else, there you would give a pint of blood, so 16 ounces. For research studies, typically the blood sample is taken at the same time you have your clinical labs drawn. And this is never done without asking your permission first. So in the context of research studies, there's a few basic rules. Actually, there's many basic rules, but a couple of the key ones are that any study that you are presented, any study that somebody asks you about, has already been reviewed by an ethics board, by an institutional review board, that's made sure that that study conforms to the expectations for an appropriate study. And there's an institutional review board at every institution. They have a common set of rules in general that they're sort of evaluating studies by. So any study that you're hearing about has already gone through this process. Typically, someone from the study staff will ask you if you're interested to hear about the study. They'll tell you about the details of the study. This ought to be done in private, and it ought to be done in a setting where you're not feeling pressured that other people are around or listening. As they present the study, they'll ask for your consent to participate. You can always say no. You can always say no, and you shouldn't feel bad about it. If you're not comfortable with it, if you don't have time that day, it is always okay to say no, and it has no effect on your clinical care. Your physician will take the same excellent care of you that they would if you participate in the study. It really has no bearing on the treatment that you receive. Okay, so what are the things that you should definitely know as you're hearing about a study? So you want to get a sense of what's the point of the study. What are they trying to figure out? And that point should sort of make sense to you. You should sort of get it and feel like that's a good idea. I want to participate in that study. You want to have a sense of what information they're gathering. So are they taking blood? Are they looking at your medical records? Are they measuring specific things? Are they asking you to fill out questionnaires? You want to have a sense about how long the study will last. Is it a one-time thing that you're giving a blood sample and that's it? Or is there an expectation that's going to go on in the future? You want to have a sense about what the potential benefits are. And for some studies where it's a study that's gathering information, either information about you in the form of a questionnaire or blood samples, there may be no obvious direct benefit. But there is the benefit of participating in a study that's contributing to knowledge in the field. And you want to have a sense about what the risks are. So I'll end here, but just say, so when you're hearing about a study, a couple of tips. So one is you should not hesitate to ask questions. You can ask questions along the way as they're telling you about the study. You can ask questions after the person's gone through it. There are no dumb questions here. There's no naive questions. You can ask whatever you want. You can always ask for time to think about it, which means if you're not sure, it's totally fine to say, thanks for telling me about it. Let me think about it. I'll come back. You don't have to come back, but you can. You can always ask your rheumatologist for advice, especially if it's a trial and you're not sure, you can certainly ask your rheumatologist what they think about it. You don't have to say yes to every study. You don't have to say yes to any study. But the way that I would sort of think about it is to consider whether you think the question that's being asked is a useful one. Does it make sense to you? You can learn a lot more about clinical trials, that is, how they're set up, what the rules are, the general structure at this website, which is run by the National Institute of Health. It's called clinicaltrials.gov. So every clinical trial in the country is registered at clinicaltrials.gov. And there's some fantastic information there about how the studies are set up, what the rules are, sort of, and other questions you have. So I'll stop there and I'll take your questions.